My name's Dr. Januszewski. I'm a medical oncology trainee in London, and I am a trainee representative on the Association for Cancer Physicians.
I'm Dr. Alison. I'm a consultant medical oncologist. I work in London and I specialise in breast cancer.
So how would you describe medical oncology?
A medical oncologist is a key person in the multidisciplinary management of patients with cancer, right from the time of diagnosis through into palliative care, liaising with a number of other disciplines throughout the process. That would include surgeons, pathologists, radiologists, close working relationship with nursing colleagues and other allied health professionals, right into palliative care. Conventionally, medical oncology is thought to be about chemotherapy, and certainly it is. But with our increased understanding of cancer, there are so many other systemic modalities of treatment, including targeted therapy. We're in an era of personalised medicine where our understanding of genomics underlying cancer mean that we can now apply much more science to the treatment that we give patients. And a skill that a medical oncologist has to have is applying the science to the individual patient. It's not just about the cancer, it's very much about the patient. So it's a very personal form of medicine with application of science all the way through in terms of understanding the tumour, understanding pharmacology, understanding molecular biology, understanding psychology. To me, it encompasses everything that's exciting about medicine. So what made you want to do medical oncology, and where are you in your career?
So I started when I was at medical school. I did a couple of weeks where I really enjoyed the variety of patients, of treatments, the teams that are involved with the patient's care. So I saw it as a speciality that kind of brought all those things together. I'm currently in ST5, having done a couple of years, and I'm taking time out of the programme to do a PhD at the moment. But for those that are thinking about doing it, I would thoroughly encourage you to do it, because it's only a 4-year programme, but that's because it's conventionally quite an academic speciality where a lot of trainees do take time out of training, and it's that advancing of treatment and drug discovery, which is one of the founding parts of what medical oncology is. I'm looking forward to another 18 months of clinical care where I will rotate through the remaining tumour sites that I've not done already, and then will become a consultant like yourself. So what advice would you give to someone that was thinking about going into a career into medical oncology?
I think if they want to do it, they should do it. It's the most exciting thing to be in. During core training, there are a number of opportunities to be exposed to oncology, and I think you need to look at it as a broad specialty. So even in surgical training, you're going to be in multidisciplinary meetings, you're going to meet oncologists, you can talk to them, we're quite friendly people. There's the opportunity of taster weeks, there's the opportunity to go to careers fairs to find out a little bit more. And I think people shouldn't be put off if they haven't done a specific oncology module, because there's cancer in everything, and I think you need to look for the oncology in the areas you're dealing with. When you're doing respiratory medicine, people have lung cancer. When you're doing gastrointestinal medicine, people have gastrointestinal cancer. And if you're interested in the specialty, you can find it everywhere, and you should use that experience to develop the reasons why it's becoming interesting to you. So what would you suggest to a core trainee who wants to find out more about oncology? How should they go about it?
Well, I'd say certainly in the first instance, you can approach an oncologist that's a trainee or consultant that's local to you or that you work with, or beyond that, there's many resources online, and our association has a very good website called cancerphysicians.org.uk.